We had a lot of challenges. Women with the disabilities or girls with the disabilities, accessibility of services was a big challenge.
Before, when we'd go to any health facility, they would make choice for you. They are being mistreated. If somebody tells you, get up, claim the bed. You're having clutches, you cannot get on the bed. And somebody asks you, but how did you get pregnant? Even you, who is you? We are also sexually active. So you find that you get pregnant and you fear to go to hospital because of the attitude of health workers.
When I go to the community, to the parents, there are some words they use. So when they want to access the services to the health facility, they feel small.
The family members, they don't expose them out. Stigma, you come out, people are just looking at you, this one is useless. Those were too much challenges.
In fact, in the past, they couldn't even look at us. We persons with disabilities were overlooked. You are supposed to give services to all the people, and you are not supposed to discriminate.
WISH stands for Women's Integrated Sexual Reproductive Health and Rights. We focus on reproductive health services, specifically family planning services utilization. We train the service providers, we train the organizations of persons with disability, and also the persons with disabilities themselves. We feel that at least the communities have been empowered and the health workers have been empowered and their capacity has been built.
We had trainings on accessibility audit. This is one of the rare things. Everywhere now I go, I look at whether this facility is accessible to persons with disabilities. I have that eye to see now that this RAM is bad, this window is too high.
So they were talking about handling our people in a good terms, give them quality care. When they come for family planning, provide for them. When they want a condom, can you give them? Because they are normal like us. They said like this, you think for them they don't have a vagina and a penis? I say, yeah. Wow, you think for them they don't play sex?
We received a lot of support from Humanity and Inclusion. This facility is able to have an adjustable bed to support, especially those who have physical disabilities.
Approaches that we have been able to use to actually raise awareness is through the community theatre activities. Now, the community theatre activities actually provide an interactive platform where health workers, where persons with disabilities and the entire community members come together and they act out a drama. And in this drama, they are so articulate of the negative things that are done to persons with disabilities. After the drama sessions, we have a team of facilitators, health workers from the health centers where we operate. They do carry on the discussion. What did you see? What was negative about this drama? And so it generates a lot of discussions, and the environment is looking like it's not a classroom setting, and so the learning is amazing. To those areas that we have not been able to roll out these drama activities, there are requests that they also need such a platform where they can bring together health workers, persons with disabilities, and the entire community members to engage.
We also left behind a directory, a referral directory. So we worked with the different partners, identified the referral points for different activities, not only for SRH, including for livelihood.
The capacity was already built by HI to advocate for our rights, to advocate for those services, to look for ways of sustainability, also for the what? For the project. After HI has left, The resource mobilization and the advocacy is to empower the OPDs, the health workers, the government officials, the community to own any other issue, anything, so that the process should continue.
I would encourage the OPDs to keep the candle burning. The skills we have given them can help them to live better life. And also to the service providers, as they already have the skills and the capacity to provide inclusive services. So service providers, wherever they can be, may not be in the very district where they're working, they should always look at quality of services with a disability lens.